Okay, so I'm Dr. Ventrella, and we're going to be talking about genes, genetic testing, and specifically the Kashi genetic test, which is something that we carry here in our clinic. So first things first is, what is a gene? Basically, a gene is fragments of DNA that we inherit from our parents, and it makes us unique. So we get a little bit from our mom and a little bit from our dad in different pieces, and that's one of the reasons that we're different from our siblings, is because we each have a unique set of genes. Genes carry instructions to build proteins in our bodies, such as enzymes. And essentially, genes are the blueprint for who we are and how we function. So in reality, genetics is a very complex topic, and it can go much beyond the scope of my practice here. But what we're going to discuss today is simple genetics, how they're clinically relevant, and what we can do with them. So the first thing to note is that during this presentation in the Kashi genetic test, we're looking at an individual gene, but in reality, they're actually a part of this really complex system that interacts with each other, similar to a cogwheel that's kind of shown at the bottom of the screen here. So what is a bad gene? So first, we need to understand SNPs, or single nucleotide polymorphisms. And basically, a SNP is a variation in gene structure. Some SNPs can be neutral, which results in no change or no adverse effects. And then some SNPs can alter function by either increasing or decreasing risk for certain conditions. So this is what we're testing for in the Kashi genetic test. We test about 34 genes and their SNPs to determine what your risk is for a certain condition and certain diseases. And we go from there. So we used to think that once we found out we had a genetic mutation, there wouldn't be anything we can do to change the outcome. But we now better understand this concept called epigenetics. And epigenetics is the change in gene expression or activity as a result of lifestyle factors. So this basically means that we can turn genes on and off just with our lifestyle. So things like diet, exercise, stress, toxic burden, etc. We have more control over these mutations than we once thought. So it's actually a really positive and exciting thing. We're not just stuck with them. And epigenetics is another science-backed reason to stress the importance of lifestyle medicine and prevention. So based off the previous slide, just because you have a bad genetic mutation does not mean that you will, for 100% certainty, get the condition or disease that is associated with it. But also the converse is true. Just because you don't have a bad gene or you have good genes does not mean that you won't get a disease, right? So if you have a bad lifestyle, that plays a huge role in health. So for example, if genetically you're at risk for poor carbohydrate utilization and glucose or sugar control, that does not mean that you'll get type 2 diabetes if you have a really healthy lifestyle. So a healthy diet, frequent exercise, low stress, things like that. Conversely, if you don't have a genetic risk factor for carbohydrate utilization and sugar usage or control, that doesn't mean that you won't get type 2 diabetes if you're eating fast food every day, you're not exercising, and you're stressed. So both can be true. And I know I just kind of gave you a lot of caveats and areas of gray to consider, but now the real question is, what do we actually do with this information? And I am by no means looking to give you a pill for each gene, because you'll be overpilled and miserable. So we're not going to do that. But I basically try to break it down into 3 categories or 3 action items. So the first one is lifestyle modifications. Exercise, diet, stress, sleep, and environmental toxicity all play a role in how we can decrease risk for certain conditions. So for example, we can help improve metabolic health by having a diet high in protein and fiber. Of course, please speak to your doctor about this, because we want to make sure that that's safe for you. And regular concurrent exercise routine, which just means strength and cardio. You kind of want to do both. Second on here are screening tests and imaging. So what labs can we regularly run? Cholesterol, sugars, inflammation markers, vitamin D, bone density scans, specialty labs like the Dutch hormone test. These screening tests basically help us to keep an eye on your risk factors, track it over time, and then determine the efficacy of our treatment. So is the treatment that we're giving you moving the needle? And this is truly personalized medicine. We can have 3 people come in with the same genes, and your labs can all look different, and you all need different lifestyle modifications and supplementation to address those things. Another example is vitamin D. So we're going to talk about how many mutations there are for vitamin D. And so they're very common. And so in this case, it's really important to track our vitamin D levels and tailor your treatment plan to your specific needs and your lab values, which I'm sure a lot of your doctors are doing. I know most naturopathic docs, I should say, run labs usually more than once a year, sometimes anywhere from 2 to 4, 5, 6, depending on what you're dealing with. So I think we're pretty good at keeping an eye on all of those labs as well. And then lastly are supplements, of course, which is number 3. So if absolutely indicated, what supplements can we add just based off of your genetics? I'm talking about what supplements can we add to better support the body? So for example, if you have difficulties methylating and you have high homocysteine production, we can give you some methylated Bs, which we'll talk about in a second, and something called trimethylglycine to improve those values. I basically call these juicy B vitamins. So now on to the actual Kashi test specifically. So it's actually I think an 8-page packet that you get, but this is the summary sheet that gives you all of the genes. And this is what I go over with my patients at least. So this is what it looks like. And it divides a bunch of genes into 5 main categories. So as you might be able to see, it's a little small: weight, heart, vitamin, graceful aging, and methylation. I don't know if you can see my cursor, but here, the far left column are the genes, the gene names. The column to the right of it is going to be the allele result. And alleles just tell us what variation of the gene do you have. And then the last few columns are what risk level is that allele associated with. So those colorful circles or non-colorful circles and arrows are the results of, are these good, bad, neutral? And, take all of that with a grain of salt, of course, as far as bad goes. And I'm going to briefly go over each of these sections and the associated genes at a very surface level, so we can get a basic understanding of how we can use these here at our clinic. So first up is weight. So these are the genes that are tested in this category. We have FTO, DRD2, MC4R, FABP2, ADRB2, SH2B1, all very creative and memorable names. So the first one on here is the FTO gene. This is actually known as the obesity gene, so to speak. And I love that this is the very first marker on this entire panel, not just this weight panel, but I love that it's the first one on here because about 90% of the time I sit down with patients with either a full or a partial risk for this gene, and they're the furthest thing from obese. So it really goes to show and illustrates the power of epigenetics and a healthy lifestyle. And then you have DRD2, which helps to regulate the dopamine response system, which, if negatively impacted, can result in poor eating behavior, alcoholism, and inflammation. The MC4R gene is associated with appetite regulation and metabolism. This can be the person who never feels full, but it's also greatly impacted by lifestyle modifications. The FABP2 gene is responsible for fat absorption in the gut and transportation through the body. And the ADRB2 gene is responsible for carbohydrate breakdown and weight loss response to physical activity. So some people might have a little bit more difficult time losing weight with physical activity. It doesn't mean that physical activity is useless. And finally, the SH2B1 gene is associated with leptin. That's our hormone that signals to our brain that we're full after we eat, and insulin regulation. So now we want to know, what do we do with these, right? So what are our action items? So general action items, and of course, this would be tailored specifically to your results, but general action items, so to speak, are this list here. Diet and exercise modifications will always be the first things on my list. And you're going to hear me repeat this time and time again. It's the most efficient and cost-effective way to not only help prevent, but in some cases, actually reverse metabolic dysregulation. So some simple dietary modifications can include things like increasing protein and fiber intake, as I mentioned earlier, moderating the time of food intake. So for example, you want to avoid eating too late or too close to bedtime. And of course, reducing processed foods and fast foods and things like that. Simple exercise modifications is honestly, depending on where you're at, just move. Some people aren't moving at all. So anything you could get in, you want to find times during the day to get up and move. Ideally, we want something, as I mentioned earlier, called concurrent training, which is both resistance or strength training and cardiovascular cardio exercise throughout the week. They don't have to be done on the same day, but it's really important to meet people where they're at and find a way to improve. So diet and exercise are always an interesting conversation because everyone's relationship with food and exercise is so different. And it's really important to talk to your doctor about your current lifestyle and steps that you can take to get you to where you want to be. By no means is anyone expecting you to have a simple one fix and you're up here, right? It's going to be a long-term solution and a long-term goal. And the whole idea is to actually build habits that are sustainable long-term. So diet is a term that we use in medicine, meaning what do you eat on the daily basis? I'm not talking about like a strict vegan diet or a gluten-free diet. I just mean how can we make your everyday life a little bit healthier? And then we have testing. So this is what I describe as, peeking under the hood. So simple serum or blood labs, such as hemoglobin A1C, fasting insulin. Those are some good sugar markers. Then we have cholesterol panels, sometimes advanced cholesterol panels. So I know quite a few of us in here run advanced cholesterol panels. So that might be like an NMR panel, oxidized LDL, things like that. Inflammation markers are also going to be important here. Sometimes specialty testing actually might also be indicated. Some doctors might feel like you need to take a look into the gut because our gut plays quite a big role in our metabolism. So that's important as well. And then the last thing on here is a body composition scan. So it might not be for everyone, but it can be a really good tool for some people to use to help measure and track data. It's just another way that we can track data. So I'm specifically most interested in muscle mass. So where's your muscle mass and where is it going? You want to make sure you have a good amount of muscle mass. And then of course, fat mass. Usually when you're focusing on muscle mass, your fat mass comes down. So it gives us a good indicator of your metabolic health, especially because our muscle mass is our metabolic sink and it makes us more metabolically active. So now onto the heart. So we have the 9p21 gene, and this helps to determine risk for plaque formation or blockage in the coronary arteries. These are the arteries that supply our heart muscle with blood and oxygen. If these arteries are significantly blocked, the heart can't get enough blood, and it actually causes a heart attack. So basically a heart attack is lack of blood flow from these vessels, those coronary arteries. Next is the NOS gene, which is in part responsible for production of a gas called nitric oxide. So it helps our blood vessels vasodilate, which means that they expand. So our blood vessels look like this. When they vasodilate, they expand open. And we kind of want our blood vessels to be pliable and malleable. So we want them to expand and contract as needed, especially since this vasodilation helps to reduce blood pressure. The next couple genes on here are the MTHFR genes. They're a part of our methylation panel, which we'll talk about in a second, but they help to methylate vitamin B9, which is folate, which basically activates it or turns it on. And if that's not done efficiently, it can lead to some inflammatory markers, and some of those inflammatory markers are specific to cause inflammation in our cardiovascular system or our heart. So that's an important heart marker as well. Then we have the AGT gene, which is responsible for aiding in fluid and electrolyte balance, which can help to regulate blood pressure. Then we have the ApoE gene. So this is a pretty popular one. It makes a protein that carries cholesterol. So you're going to see here fat and cholesterol transport and levels. This gene is in the heart section as well as in graceful aging. One of the reasons that it's a commonly known gene is because certain ApoE mutations are correlated with higher risks of early onset Alzheimer's. So that's before the age of 65. So I always, tell patients this when we're ordering the test, that the ApoE gene is on here, which is like that Alzheimer's risk marker. If you do not want to know, I would say about 20% of my patients, maybe a little bit more than 20%, but 30% of my patients do not want to know their ApoE risk. So I'm telling you now, it's on this panel. So if you don't want to know, then we can totally not do the panel. But it is a really interesting marker, and it kind of gives us an idea of what your risk factor is and if there's other things that we could do to better support you and, be more aggressive with prevention. And then finally, there's the SCLBO1B1 gene, which is a really interesting one because it actually helps us determine if someone is a good candidate for statin medications. Statins are just medications for lowering cholesterol. Certain mutations in this gene lead to poor breakdown of statin medications, which means the medication is in your body for longer, which can increase the risk of side effects. One of the most common ones is like muscle pain. And now on to our action items. So similar to weight, we're going to start with diet and exercise, which I already kind of harped on about. Then some lab testing that might be indicated include, basic cholesterol panel, advanced panels, the NMR, oxidized LDL, high sensitivity CRP, ADMA, LPPLA2, homocysteine, among others. There's quite a few extensive labs that we could do for a lot of cardiovascular markers, which is really nice because it's less invasive. We can get a lot of data just from blood, which is good. And then, of course, we have some screening imaging, which can include coronary artery calcium score to better assess risk of a cardiovascular event. We can always, if you have symptoms and you're worried, we can always refer to cardiology for further testing. So that's things like your EKGs, your echocardiograms, stress tests, Holter monitor if needed, things like that. And then, of course, another big player in this would be to work with your doctor to tailor your treatment plan based on your lab results. So if you do have high oxidized LDL and ADMA, your doctor can walk you through treatment options. How can we help support that pathway that's causing those inflammation markers or that elevated cholesterol and track it over time and go from there. Next up on the docket here is vitamins. So the first 6 genes, I mentioned earlier, we're going to talk about vitamin D, but essentially the first 6 genes on here talk about vitamin D. So how is it absorbed, binded, transported, activated, used, broken down, etc., kind of the whole life cycle. So low vitamin D is associated with many risk factors such as metabolic disease. For example, vitamin D is really important for insulin function, and is also a risk factor for many cancers, especially colorectal, breast, and prostate cancers. So talking about prevention, another way to keep an eye on things is to look at your vitamin D levels as well. TMPRSS6 is a gene associated with iron absorption from the gut. So it can tell us if you're at risk for iron deficiency. BCMO1 gene is associated with the activation of vitamin A, or basically how our body turns it on and uses it. And then finally, the FUT2 gene is associated with vitamin B12 absorption. And vitamin B12 is really important for our nervous system and our brain and functioning. Back to the action items. So first up on the list is safe, and I'm going to stress safe sun exposure, which is roughly 10 to 15 minutes, maybe less for some people, in direct sunlight without sunscreen to absorb vitamin D. And I stress safe because obviously we want to avoid skin damage and any potential risk for skin cancer. So especially if you're fair skinned and you have a family or personal history of skin cancer, you want to be extra safe. So if you feel like you're getting pink or burning, obviously go back inside and shorten your exposure. What one person might be safe at 10 minutes outside, maybe you just need 3 to 5 minutes. So definitely tailor it to you. And then next up is labs. Vitamin D, I talked about how important vitamin D is, and you'd think living in Arizona, we would all have really beautiful vitamin D, but that's just not the case, because as you saw on the previous slide, there's a lot of room for error with respect to vitamin D's life cycle. So you can have a hard time binding vitamin D, transporting it, using it, things like that. So it's really important to track it and then basically adjust your dosage based off of your labs. So with that being said, it's important for these markers, if you have a risk allele, so that we can see your current vitamin status and then individualize your treatment plan. And up next is graceful aging. So the WNT16 gene plays an important role in bone regulation. If there's a mutation of this gene, there's a higher risk for increased bone loss, leading to osteoporosis, which is just a fancy word for bone loss. And then there's 2 ESR1 genes, which are involved in estrogen's role on bone mineral density and bone turnover. So there's a lot of talk about bone in this graceful aging section because falls, usually due to brittle bones, are the leading cause of injury-related death in people 65 and older, which is just mind-blowing. I feel like we do a disservice to our older population by not screening for this and not kind of keeping an eye on their bone health even earlier on. So it's really important, and it's definitely something that we want to look at for prevention, is bone health and vitamin D status and things like that. So the COMT gene is up next, and it helps us break down catecholamines, which are things like the adrenaline hormone and dopamine. It's also important for breaking down our estrogen into a safe form. If someone has a COMT mutation, we want to be safe with estrogen replacement therapy and ensure to support their estrogen breakdown pathways. And then we have the CYP1A1, which is a gene that codes for an enzyme in our liver. And similarly, it breaks down estrogen and also breaks down toxins and drugs and things like that. So it's similar to COMT. So it tells us, do we need to add in more liver and estrogen breakdown support, especially if, someone's on estrogen replacement therapy. We want to make sure that they're detoxing it efficiently. And then MAOA is a gene that helps break down serotonin, dopamine, and norepinephrine. And then lastly, that's the ApoE gene back again, which gives us the risk for plaque formation in the brain, which is more specific to the early onset Alzheimer's, that brain plaque formation. And once again, diet and exercise, especially for healthy, strong bones. I harp on about muscle health for a lot of people, but basically the stronger our muscles are, the stronger our bones get. So it's really important that we're kind of keeping an eye on those things and doing all of the lifestyle modifications we can. DEXA scans are those bone mineral density scans. So they're x-rays that basically tells us someone's bone density. And they're done every 1 to 2 years after menopause, usually to track bone density, depending on what your scans look like. And then also some labs. So labs might include cholesterol, advanced panels, vitamin D. Vitamin D is really important for bone as well. And then specialty tests. So, an example would be the Dutch test, which helps us determine what your breakdown capability is right now. So remember that you have the gene, it doesn't mean that you're fully expressing it. So what is your body actually doing as far as breakdown? So if you have a specific gene that we want to keep an eye on, we can look at your actual breakdown. Another one would be a neurotransmitter test. So kind of gives us a picture of what your neurotransmitters are actually doing. And neurotransmitters are just those signaling molecules or communication molecules between our nerves and our brain tissue. So that could be another option for you as well. And then fifth and finally, I think this is the fifth section, is our methylation panel. So first I want to hop over to the next slide to talk about what the heck methylation is. So methylation is a chemical process that naturally occurs in our body. It's the addition of a methyl group, which is just a carbon and 3 hydrogens, which is the black and the silver little balls on the left there. Addition of the methyl group to a chemical compound. So there are many different reasons for methylation to occur, and then there's many different outcomes, but for the sake of this panel, we're going to keep it simple, and we're just going to use vitamin B9. So a methyl group is added to folate, which is vitamin B9, and it activates it or turns it on, and it creates methylfolate. And this reaction or this change is mediated by the MTHFR enzyme. And we're going to look at our MTHFR gene. So going back to the previous slide here, I'm going to skip over the NOS for a second, just since we already talked about MTHFR. So these 2 MTHFR genes, which were up in the heart section, and they're back down here because they're methylators, they help to methylate folate and activate it. So this is the reason why certain podcasters, I have a lot of people come in asking about methylation because of a few podcasters, which is awesome. I'm glad that, we're learning more about it. So these podcasters will say to supplement with a methylated B vitamin and not folic acid. So you have folic acid or folate, the MTHFR gene is here, and then methylfolate down here, active form, inactive. If we're supplementing with the inactive form and you have a sluggish MTHFR mutation, then you're just overpopulating the inactive form. So we supplement with the methylated form of B vitamins. For how many processes, B vitamins help in our body, it's a very simple fix. Going back to that juicy B vitamin, it's a pretty simple fix for a lot of issues that can potentially arise from it. There's a lot of, depressive symptoms, miscarriages, gut stuff. There's a lot that can come from poor methylation. And a lot of these, I should, kind of mention that most of this panel is interacting with each other, going back to that cogwheel explanation. So the MTHFR interacts with the CBS and the MTR and the MTRR. So they kind of all build on each other. So we want to look at all of them. And that's why it's really nice to have this full panel. So then next up is that CBS gene. So it uses vitamin B6 to convert an inflammatory byproduct called homocysteine. Maybe some of you have heard it. You can test this in your labs. Homocysteine into a safer byproduct, cystathionine, which is important for the production of a major antioxidant called glutathione. And then you move on and you have the MTR and MTRR genes, which plays a role in this whole picture, basically. And it uses the byproducts to make folate and methionine. And then lastly, since I skipped over it, back up at the top, you have that NOS D298E, which is similar in function to the NOS gene we talked about in the heart section. It helps to regulate nitric oxide synthesis and helps to regulate blood pressure. And kind of going back to the action items, we talked about methylation and, giving methylated Bs are a really good action item. There might be some other nutrients that help to support those pathways. Trimethylglycine is usually a pretty good option for treatment as well, depending on your results, of course. And then this is basically, how do we do this test? This is my quick screenshot of what it tells us. So basically, it's very simple. It's done in office. It's like maybe not even 5 minutes. And we just need to make sure that you didn't eat, drink, or use tobacco products at least 30 minutes before collection. So usually if you're coming in for an appointment or a visit with your doc, you're probably sitting there for 15 to 30 minutes, maybe 45, depending on the visit. And so just no eating or drinking while you're in the visit. And we could just do it after your visit. And there's 3 little swabs, and you're going to basically brush the swabs on the inside of each of your cheeks for about 20 seconds. And you're doing that 3 times. And then we package them up and we ship them out. And the turnaround time for the results are anywhere from 2 to 3 weeks. And once they're in, you could go over them with your doctor, and it's pretty simple. And we basically break it down the way I did today. We go through each of them and how they interact with each other. And, I usually I refresh myself on your labs too. It's like, oh, you have this gene, and maybe that's one of the reasons why we're having a hard time with your cholesterol or things like that. But it's really helpful information. And, genetics is a fun thing to play around with. But that's pretty much all we have for our Kashi genetic test. So thank you for those of you who have tuned in, and I'll wait around for a couple of minutes to see if you have any questions. The genetic test, how much is it? I believe it's $375. I would have to confirm that, but I believe it's about $375. Yeah. It looks like those are all of the questions. And of course, if you guys have more questions, you can shoot me or your doctor a message in the portal. But thank you guys for tuning in. Have a great weekend.